Right, how can I help you?
Yeah, I would like to opt out of the MSP system.
Okay, are you moving or anything, or you just want to opt out completely?
No, I don't want to receive your services at all. I don't want medical intervention at all because I do not
Okay.
trust your services, and I feel that it robs people of opportunity
Okay,
to
yeah,
keep.
for sure. Anything to do with opting out, I'm just going to get you over to our enrollment, and they'll talk to you. So let's see, one moment.
Okay.
Your call is being transferred to an agent. Thank you for calling the Health Insurance BC Enrollment Specialist Unit. Please note this call may be monitored or recorded for quality assurance purposes. We collect, use, and disclose personal information in accordance with the Freedom of Information and Protection of Privacy Act. Good afternoon, Health Insurance BC, Etta speaking. How may I help you?
Yeah, I would like to permanently opt out of your MSP program.
Okay, just one moment. Okay, do you have your care card number or account number?
No, I have no care card, and I don't care to receive any bills because I never made any contract with you guys, and I don't care to receive any medical intervention in the future because it's substandard and mediocre at best for some
Right, may I
people.
have your last name, sir? You've been receiving bills?
No, I don't want your services at all. I mean, the only service that I require if I'm, like, injured to a point where I require surgery that's gonna cost taxpayers $20,000 would be, maybe some painkillers for my way out of life, okay? Other than that, I don't want your death care. I don't want the,
Okay,
loss
sir,
of
that's okay.
opportunity.
You don't even have coverage at this time.
Yeah, that's
It is,
fine, but I
okay,
don't
sir,
want to
there's
receive,
no bills that will be
excuse me.
coming. I will send you out a op kit for the future, but right now there is no billing. So if there's not anything else, I'll send that out, okay?
Yeah, I don't really
Just,
care
sir,
for, is this
I
retro,
don't need to hear your
is this retro,
opinion. I
is
just
this
need your address to send that
Is
out,
this
okay?
retroactive?
Okay, may I have your address and I'll send that
Is
out.
this retroactive?
You have no coverage. You have never had coverage here in
Yes, I
BC.
know, but you guys love to send bills to people who have been here for a while. I don't care to receive your bill for
Okay,
like
sir, you don't
4,800
have a
bucks.
bill, you don't have coverage. We're not going to send you one. It is mandatory to have health care, so you do need to opt out. If you give me your current address, I will provide that for you.
Okay,
Okay?
yeah, that's
Okay, I'll get that out to you as soon as possible. Okay?
okay. And what are the requirements for this opt-out kit? Are you
Just
required?
need to sign it and realize that if you get hit by a truck, we're not going to be able to assist you, and you need to sign one every year because the Ministry of Health has mandated as mandatory. And
What?
a new kit every year to sign out.
Okay,
But you have no HACA coverage right now.
what is the legal remedy for having to be obligated to do this every year? I just want to do it once. I don't
This
want your
is
services at
regulated
all.
by
I have no contract
you'll
with you
have to
guys.
speak with the Ministry of Health, so I'll send that out. And the kit is quite intensive, so read it all up, and you'll have all the answers to your questions. Okay?
Is there any
Bye-bye.
chance you can transfer me to the ministry? Fucking rude people. Okay, I'll talk to the minister.
Good afternoon, Minister's office.
Yeah, I'm just wondering, what's the legal remedy for the annual harassment that I'm obligated to receive to opt out of MSP?
I'll put you through to that number. Just a minute,
No, no,
please.
no, no, I was just talking to them. They told me to call you guys.
Who told you to call who? Sorry,
I
you
was
have to...
just talking to MSP and they told me that I'd have to bring it up with you guys, okay? I have no contract with, Health BC, okay? I have no contract with you guys. I don't want your death care. I don't want your bills. I don't want any services from you guys whatsoever.
Where is it that you're calling from?
BC.
Okay, but you don't have health coverage?
No, I haven't had health coverage for 4 years, and I'd rather it remain that way. And I'm not. I'm going to be filling out an opt-out form, but I don't want to be harassed for opting out. Okay, and I'd like to know what my legal remedy is to avoid being harassed on an annual basis when I'm making it clear that my wishes are for me to own my body, for you guys to keep your hands off of it, and if I'm dying on the side of the road, the only thing I want you guys to do is give me painkillers so it's an easy ride out of life, okay? I don't want your intervention whatsoever.
Okay, I can give you our email address if you'd like.
No, I would like to know how I can opt out without being harassed on an annual basis. Why do I need to use an email address? I'm contacting you because you're the Minister of Health's office. You should
Okay,
know
would
this
you
stuff.
like to leave your name and number?
Yes.
Okay, thank you very much.
Thank you. I'll be waiting patiently for that call back. Do you have a time frame as to when that's going to happen?
I don't. It'll be a different office, but I will definitely pass it along, okay?
Okay.
Thanks, bye.
Bye-bye. Fucking parasites.
Okay. And sorry, what kind of information are you looking for, Ryan?
Okay, well, I've been doing some investigating into the MSP opt-out, and I'm wondering what are the legal remedies to the annual harassment that's given to people who opt out, who would like to opt out for more than just a year.
Sorry, so your question is about harassment?
Yes, absolutely. Because there's people who would like to opt out permanently out of the MSP system, and the only provision that's provided is the obligation to fill out some incredibly complicated forms on an annual basis. And what I'm wondering is, because the law is supposed to provide remedy for such things, what is the remedy to the waste of time and the burden that's being imposed on people who do not want contract and do not want service?
And Ryan, what's your phone number, please? Hey, Ryan, here, just give me a second. I'm going to put you on hold, okay?
Okay.
Thanks. Hey, Ryan, sorry about that. I'm
Hi.
just going to have somebody give you a call back, okay?
Okay.
Okay, great. So I've got your number. Any particular deadline?
A week from now?
Okay, fair enough.
All right.
Okay, thanks, Ryan.
Thank you.
Cheers, bye.
Bye-bye. Yeah, we'll see if I even get a call back. So this is how social engineering works. They create a system that is mandatory, and because they're obligated by law to provide a legal remedy, they make sure that the legal remedy makes you jump through so many hoops that it's not even worth it, and therefore they get their way. Okay, I don't want health care from you guys, okay? I don't like the price tags that are attached. I don't like how you guys pick which healthcare services are appropriate to me, okay? It's my bloody body. It is my body, okay? Basically, the lack of choice that's being offered and the lack of legal remedy is exactly where I have a problem with this. The law is supposed to provide remedy to everything. Well, where's the remedy to these parasites who assume ownership of your body and who decide how to treat your body? I should have my wishes respected. And presently, I do not want to receive the burdens from this system for the crappy benefit that I might receive 30 years down the line, okay? I'd rather take my chances. As a healthy person, I'd rather stick with the hands that I've been dealt with in life. And I'd rather not have a bunch of statists weighing me down. So, true, you can opt out of the system on an annual basis. They inundate you with paperwork and force you to fill out a bunch of forms year after year after year. And I'm just saying, I want out. I don't want your health care. I don't want anything from you guys at all.